Hi, I'm Dr. Paresh Shah from Winnipeg, Canada, and I'm a Seattle Study Club co-director with my colleague up there. And I wanted to talk to you about a system that I've incorporated in my practice that allows us to create more consistent protocols and accountability and time management in my practice. And those are called checklists. And I've incorporated those checklists several years ago. I guess I'm almost referred to like a checklist Nazi at my practice, but it really has made an impactful difference in the workflow of our practice and in the care of our patients. We have checklists that are used throughout the practice for our clinical dental assistants who work with me, as well as my associate. We have checklists for our hygienists who also work with me, and we have checklists for our business systems and the business team. And let me give you an example how we use that. The checklists are on a sheet of paper and that are laminated. We make them out of an Excel spreadsheet or a Word document, and they're customized. So let's say we're doing a crown preparation. Well, what will happen is right from the time before the patient is even seated, it'll list the materials and the products that we need in the operatory at the time before we bring the patient in for the procedure. How many of you hate stopping in the middle of a procedure and waiting for your assistant to rummage around for 5 minutes to find a burr? This doesn't happen because it's all on that checklist. And they also have to, I don't come into the treatment room until they've signed off and updated the medical history. Then when I come in, I've got that on my checklist underneath to verify the medical history and then continue on. What that creates is a system where now we have efficiency because everything's there. We don't have to wait those 5 or 10 minutes for anyone to run around getting extra things. So we make up the time from the beginning where it might take a few extra minutes to get the patient in. On top of that, it's accountability. Because now when something isn't there, and if they've skimmed through the checklist really fast, which happens after you get comfortable with them for a while, you just look and they'll go, oh, it's my bad. I own that one. I'll take care of it. No one's blaming other people because they're accountable for their room. And so that really helps. My second tip, well, how do you train? How do you train the staff on this? Well, book Checklist Manifesto is how I ended up incorporating the checklist. It's a fantastic book. Some people don't like reading. The author is Atul Gawande. He has a TED Talk. It's 20 minutes. It's impactful. It explains the benefits of it, and he explains it in the healthcare system. Put the TED Talk on for 20 minutes during a staff meeting, and most of them will get it. Those are my 2 tips, and I hope they will help you in your practice to be more efficient and productive.